Radio Menopause, lifestyle, health, nutrition. Today I'm talking about menopause and diabetes. Type 1 diabetes happens when your body cannot make enough insulin. Insulin is a hormone which controls blood glucose. Type 1 diabetes is not linked with age or being overweight, which are linked with type 2 diabetes. If you are not diabetic, perimenopause and menopause do not directly cause diabetes. However, as the hormone levels change during perimenopause, the risk of developing diabetes increases. This is mainly because the body starts to store fat around the middle of the body, which affects how insulin works and may lead to insulin resistance. Insulin resistance is when your body's cells do not properly respond to insulin and your blood levels of glucose increase. This may also happen in women who have a healthy weight. Fluctuations in hormone levels can make it more difficult to control blood glucose levels, causing them to swing erratically for no apparent reason. Other risk factors for type 2 diabetes are leading a sedentary lifestyle, family history, and having or developing high blood pressure. If you are diabetic, you will be aware of hypoglycemia, which is where the blood glucose levels drop too low. Some menopausal symptoms, such as hot sweats and palpitations, are very similar to hypoglycemia, so you may need to check your blood glucose level more often. If you're having a hypo, treat it as you normally would. If it's a hypo combined with a hot flush, always deal with the hypo first. The following tips can help you manage your blood glucose levels, menopause symptoms, and reduce associated risk factors. Cut down on caffeine and alcohol, as both can disturb sleep and make hot flushes worse. Alcohol is also very high in calories, so cutting down will help you manage your weight. Quit smoking, as it increases your risk of heart disease and osteoporosis. Stay active. This helps your insulin to control your blood glucose more effectively. It is particularly useful to go for a walk after a meal. Nutrition. Cut down on processed foods and increase your fiber, fruit, vegetable and whole grain intake. This helps control weight and maintaining a healthy cardiovascular system. Check your blood levels regularly and discuss your options with your doctors, pharmacists or nurse. Blood pressure and cholesterol needs to be checked regularly to screen for cardiovascular disease. Although it is clear that HRT can reduce the risk of developing type 2 diabetes, it should not be started just for that reason. As always, if in doubt, don't just assume or struggle alone in silence. Speak to your healthcare professionals. Thanks so much for listening to this episode of Radio Menopause. Make sure you get every episode by hitting the subscribe or follow button on the podcast. I will see you here next time. Goodbye.